Okay, so I'm Dr. Stevie. I'm one of the creators of Dentistry Dashboard. So I'm a fellow dentist myself, and what we're trying to do is just make people's note taking a lot faster and also the notes a lot better. So I'm just going to quickly run through what we can do with Dentistry Dashboard. We've got a lot of different features, but we're just going to focus on the AI note section here. When you first come into the platform, you're going to go into the dentist zone and click on the dentist zone and click on AI notes. So what we try to do is make this as easy as possible for yourself. So basically a series of steps: step one, step two, and then we generate a note. So what the system does is you are going to need a microphone to get the best use out of the system. And so in terms of the microphones, I like one of these. These are Hollyland, but you can get whichever microphone you want. This one just basically clips over here, and this will be cool, the whole conversation with my patient. So then what we're going to do is we're going to click on start transcribing. So as soon as we click on this, the system is basically listening to us and is turning our audio into text. Every minute or so, you will see the text come onto the screen. I wouldn't worry too much if gets it slightly wrong or anything like that, because our second AI is going to read through all that again. But it's been listening, so if I just click pause, it's going to take about a couple of seconds or so. As you can see, it's basically just converted all that into text. I am going to click on new chat, and then what we are going to do is I'm actually going to see a patient right now, and then we're going to show you how the rest works. And as you can see, it has transcribed all this text. That is perfect. And it's going to even be writing notes in this box here. And what the system is going to do, it's going to read everything in step one, and then it's going to convert all this into a set of notes. So I've done that. So next what I'm going to do is I am going to my appointment type. I'm going to click on dental exam. We've got lots of different templates, but if you do want to upload your own template, and our AI will fill your template out, click on add new appointment types, paste your appointment type in here, any additional instructions, the name, and then that will be saved in your list for future use. I'd say most people use our template and feel free, but if you do want to add your own, by all means, add your own. So I've clicked on dentist examination. My nurse today was Sarah, so I'm going to click on Sarah, and then I am going to generate my notes. As I said, it's going to look at all your recordings in step one. You're going to choose your appointment in step two, and then it's going to generate your notes in step three. Don't worry if you're speaking about the weather or the football, because the AI is not going to really include, unless you specifically say you wanted it included. It's only going to try and stick with the dental relevant stuff. So then what I'm going to do is going to read through my notes. I'm just going to full screen because I still want to see a little bit better. And so everything we've discussed with the patient is all in there. That is perfect. If I do want to make any changes, I can basically delete this or add to this. Really, whichever you want to do, but the key thing is read through it all, make sure that you're happy. Once you're happy, then you are going to click I have approved this, and then more. So I'm going to copy that because I'm happy with those notes, and then I am going to paste that into my notes here, and then that's all done. The notes have saved onto the left-hand side as well. So if I do want to go back and look at a note, if I didn't have time between patients, I'm going to go to step 5 next. So step 5 is when if I want to do a quick referral letter, or if I want to do a letter back to the patients. Patients love these letters because what the system is going to do, it is going to read through my notes and then convert that into a nice patient letter. There we have it. If I do want to make any changes again, I can make changes just by writing on it, and then I can copy that into my PMS. And that is how you speed up your note taking. On average, people say they're saving about an hour a day. So hour a day, 5 hours a week, 20 hours a month. And so for the price of £40, for 20 hours, getting 20 hours back is a no-brainer.